Hey guys, Dr. Childs here. Today we're going to be talking about what doctors get wrong about Hashimoto's thyroiditis. This is really important for you as a thyroid patient, especially if you have Hashimoto's, because the way that your doctor looks at your condition sort of determines how he or she is going to help you with treatment and help you potentially get better or not. So if you don't know me, I'm Dr. Childs. I'm an internist and I specialize in treating people with thyroid problems, people with hormone imbalances, and of course helping people lose weight. So today we're going to talk a little bit about Hashimoto's, which is a thyroid condition. So as I mentioned before, there are a lot of things that doctors get wrong about this particular condition, which is Hashimoto's thyroiditis. If you don't know, it is the most common cause of low thyroid or hypothyroidism in the United States. So this is the number one cause of low thyroid in the United States. Tons of patients have this. In fact, many don't even know that they have it because doctors actually don't really test for it all that often because what we'll talk about in just a minute. So these are really important for you to know if you have this condition. So let's start with number one here. And you can kind of consider these myths as well in a way, but it's really how your doctor is looking at this condition and why it's incorrect. And how it will potentially cause problems for you down the road. So number one, your doctor will say that Hashimoto's is just a thyroid condition. So it is true that it is a thyroid condition, but it's not just a thyroid condition. The other aspect of it is the autoimmune condition. So remember, let me write that in here. So plus thyroid. So if it were just a thyroid condition, your doctor would say, okay, no problem. If your thyroid is low, let's throw you on some meds. It'll increase your thyroid and we'll call it a day, right? That's how a doctor would treat normal low thyroid. But if it's an autoimmune disease, then that's an indication that your immune system is going haywire and it is attacking your thyroid gland, which your thyroid gland kind of looks like that. It's like a little butterfly. So your immune system is attacking this, which is causing the damage, which then causes low thyroid. So you can kind of see the cause and the effect. But your doctor doesn't look at this half of the equation. They look only over here at the thyroid condition. But this leaves it's leaving an opportunity on the table here. Because if you know that your immune system is causing the damage, what if you could reduce the immune dysfunction in your body, which would reduce the damage to your thyroid gland, which would then mean that your thyroid could potentially improve naturally and without the use of thyroid medication. Now, what's interesting here is that doctors know it's an autoimmune disease. They know it's your own body attacking your own thyroid gland. And there's a lot of other conditions like this. And I want to compare the way doctors look at just one compared to how they look at Hashimoto's. So take, for instance, the autoimmune disease rheumatoid arthritis. So rheumatoid arthritis is an autoimmune disease in which the body is attacking the joints. All right. So in this condition, doctors know this, right? They know that the body is attacking the joints and will eventually destroy the joints. But they don't say to the patient, well, you have RA, your body's eventually going to destroy all your joints. Let's just wait until your body destroys those joints, and then guess what? We'll replace them. Because we can send you to an orthopedic surgeon, we can replace your joints, no problem. Now, yes, that might happen, but how do you think the patient would react hearing something like that? Do you think they'd be thrilled to hear that eventually their body's going to destroy their own joints and they'd have to get them replaced? Or would the patient say, hey, can we prevent that? Is there anything that we can do to stop that destruction? And the doctor would say, yeah, let's put you on some anti-inflammatories, let's reduce the immune system, we'll suppress it, we'll do all these other things, we can maybe use some steroids, etc. Now, these aren't necessarily good therapies that I would recommend, but my point is they never do that for Hashimoto's. They just say to the patient, it's actually called the sit and wait approach, by the way. Let's just sit and wait until your body destroys your thyroid enough so that then I can put you on thyroid medications and we'll call it a day. So even though your doctor knows this and practices medicine differently when it comes to other autoimmune diseases like RA or rheumatoid arthritis, there's a bunch of them, MS or etc. There are tons of autoimmune diseases. They treat Hashimoto's differently than they treat all these other conditions. And I'm actually not clear why they do that, other than I think they believe that treating with thyroid medication is just the easiest route. But for the patient, it obviously isn't. If you have this condition, you want to treat your immune system, and that should be the focus of your attention. But your doctor is going to completely just leave that part out. In fact, they may or may not even check your antibodies. They certainly won't check them over time. They certainly won't recommend therapies to potentially reduce those, which brings us to our next point. Your doctor will say it is not curable or reversible. So they will say Hashimoto's thyroiditis, the autoimmune disease of your thyroid, is not a curable condition or a reversible condition. They will say that it is going to be something that's with you forever. So we'll just do lifelong. and you're going to have to deal with it for the rest of your life, and you'll probably have to be on thyroid meds forever. That's how they view it, okay? Now, I'm here to tell you that that's definitely not true. Now, yes, there are cases in which they're incredibly hard to treat, and you won't be able to necessarily reverse them or cure them, but you will be able to reduce the damage done to your body such that you may not have to be on a high dose of thyroid medication for the rest of your life. Or you can reduce it potentially and reverse some of the damage that's been done to your thyroid. Even though it's there and it's kind of smoldering, it's better to have a smaller level of inflammation and damage than a higher level of inflammation and damage. So even if you can't cure it, you can definitely drop it and improve your situation. Now, I'm not the first to suggest this, by the way. There are plenty of other women out there, case studies, doctors who are doing the same thing. So this hopefully doesn't come as a shock to you, but I'm just letting you know that yes, Hashimoto's is the autoimmune aspect is definitely treatable. The thyroid condition is obviously treatable. You can do that with medications or supplements, but the actual autoimmune component of it is treatable as well, and in some cases reversible. In fact, I have a case study that I just wrote about on my blog that talks about a patient who did it to herself. She cured her Hashimoto's and put it into remission all by herself. She used my resources to sort of help her out and change her diet and take some supplements, but she didn't need a doctor to do it, which is sort of the amazing part about it. So don't let your doctor suggest to you or tell you that it is not curable and not reversible. Like I said, it may not be in every single case, but you can definitely improve your situation by doing certain therapies. So that's number 2. Number 3 is they will try to suggest to you that the best treatment for Hashimoto's thyroiditis is levothyroxine. So if you are a thyroid patient, you probably know what levothyroxine is. If you don't, it is a thyroid medication that contains T4 only. So it is a prescription medication that doctors frequently use to treat people who have low thyroid, right? Because if you have low thyroid, then the treatment is to try and increase that thyroid, and they do that by providing your body with the medication that would make up the difference. Now, the problem is almost every single doctor will recommend levothyroxine as the #1 standard of care treatment of choice for anyone with low thyroid, including those people who have Hashimoto's. The problem is at least 20% of people, and this is being very conservative in my estimation here, at least 20% of people do not do well on single isolated T4 medication only. So that means that 20% of people will not do well just taking levothyroxine. These 20% of people need a combination of T4 plus T3. So if you look at this from this perspective, just mathematically, that's 1 out of 5 people who have Hashimoto's will not do well taking levothyroxine alone. Now, the reason for this is a little complex, but the idea is that your thyroid gland produces both T4 and T3 when it's in the healthy state, and if your thyroid is damaged and you don't provide it with the T3 and you only give it the T4, it will be missing out on something that it would be able to produce otherwise. And so a lot of people just don't feel well when they do that. If they replace it with one and not the other, they just simply don't feel well. So do not accept that the best treatment is levothyroxine. There are many other treatments, many other medications that you can look into, including some of the natural therapies, which we'll talk about in just a minute. But if you have Hashimoto's, if you are taking levothyroxine, if you are not feeling well, look into these other thyroid medications. There's other forms of T4, there's combination T4, T3, there's natural desiccated thyroid. You have plenty of options, 10 plus different medications that you can choose from, but your doctor will probably only ever recommend one. Okay, so that's number 3. Number 4 is natural. Your doctor will suggest, by the way, that natural therapies, and I'm using an example here like diet, simply don't work. There's no evidence to show that they're effective. If you do them, you're wasting your time, you're wasting your money, etc. This is just sort of the mentality and the mental state that almost all doctors have regarding natural therapies in general, unless they are trained in integrative medicine, which not many are nowadays, but more and more are doing this. So they will suggest that these therapies do not work, except we have one big problem. We have science and medical research which show that they do. Okay, so in fact, more recently, as I was writing this, I hadn't looked in the past year or so, and I found a bunch of interesting articles showing exactly how diet can impact the immune aspect of the thyroid of Hashimoto's, which improves the thyroid naturally. And one of the studies I was looking at was taking people who did the AIP diet, which stands for the autoimmune protocol or autoimmune paleo diet, and they saw an improvement in thyroid function. We also have other studies, which I've talked about before, in which people that took let's make sure you guys can see that. This is a bad handwriting here, but it says decrease in dairy. So we have people with Hashimoto's who went on the AIP diet who saw an improvement in thyroid function and a reduction in autoimmunity. We also have women who just simply removed dairy from their diet who had an improvement in their TSH as a result of just doing that. So if your doctor is suggesting to you that diet plays no role in this condition and that it's not a potential therapy, then that is someone who just simply isn't educated. I don't know how else to put it. Diet is absolutely something that you should be looking into. And by the way, when I'm talking about diet, I'm not talking about reducing your calories to try and lose weight. That's not what I mean. By diet, I'm talking about the foods that you're putting into your body day in and day out, the lifestyle that you have, the quality of the food that you're putting in your mouth. And there are tons of different diets that you can use. In fact, I have an article, or I have a video completely on that. So things like the elimination diet, Whole30 diet, paleo diet, the AIP diet, even the ketogenic diet, the carnivore diet. All these diets have similar things in common, but they're just tweaked a little bit different in terms of the macromolecules that they want you to consume. But they all can be beneficial provided you do it correctly. So don't accept that when your doctor says natural therapies like diet don't work, because they do. In fact, we have the science, like I said, to show it. I'll see if I can I definitely have the links to those scientific resources and articles in my blog post, which is on this very topic. So if you're looking for those and you want to show them to your doctor, you can get them directly at the blog post. But I just wanted to explain that they do work. In addition, there are other things that you can use, like supplements. So supplements can also be beneficial and can also help. So supplements, especially in the setting of Hashimoto's, things like selenium, have been shown in some studies to reduce antibodies. So that can be effective as well. So bottom line is, don't accept that these natural therapies don't work, that you have to be put on levothyroxine, that it's just your thyroid, and that your condition is going to be around forever and it's not curable or reversible. All of these things are false, okay? But they're things propagated by physicians. And if you don't know any better, you'll probably just believe your doctor and be like, oh, okay, well, I guess this is just a lot I've been handed. But it's not the case. So I want to hear from you guys. Have you tried any of these things? Has your doctor said any of these things to you? Is this what led you to this type of video or this sort of information? Leave your comments and your experience below. I want to hear about those because it's always helpful for me and for other thyroid patients to hear from you guys. And lastly, make sure if you haven't already that you download my free thyroid PDF resources. I have at least eight free resources that you can download, which contain tons of information just like this, which are all designed to help you as a thyroid patient, even with Hashimoto's or any other type of thyroid condition, including if you don't have a thyroid, etc. So make sure you download those, and if you have any questions, leave them below, and otherwise I will see you guys in the next one.